Perfect. So let's go ahead and do the lower extremity today. And so we will start off here by talking about the muscles of your thigh and your hip. So we're going to go right into how we organize the different compartments of the thigh. Your thigh is going to be that portion of the lower extremity between your hip and your knee. And so we saw how the deep fascia in your upper extremity created these compartments. Well, guess what? Same thing. We are going to use, all right, deep fascia in your lower extremity to also make some compartments. Folks that are going to be first responders, I see this will be helpful, but I really see it more so in folks that are considering going into sports medicine, knowing these compartments, because if any of the structures in these compartments, or if a blood vessel were to be damaged and to where you were bleeding into the compartment, it can really compromise the functioning of the tissues in the compartment there, namely the muscles. So let's start off by going over the 4 compartments. There's 4 compartments to the thigh: the anterior, the posterior, the medial, and the lateral. So when we're talking about the movements that the muscles have in those compartments, it's nice because depending on location will pretty much help you to discern what type of movement, but also the muscles that are close by will have pretty much, not all of them, but will have similar functions and movements there. All right, so the anterior compartment muscles are going to flex the thigh. What is that? That's if I ask you to bring your knee to your chest. They'll also extend the knee. Okay, so when you're extending the knee, you're straightening your leg. Okay, the medial compartment muscles are going to undergo adduction of the thigh. That is, if you're doing a jumping jack, when your legs are far away from each other, that is AB, abduction. So when you bring your feet back or your legs back in, close to each other, that is ADD, adduction. So the medial compartment muscles will adduct the thigh. Lateral compartment muscles will abduct the thigh, pull the legs away from your midline. And then the posterior compartment muscles are going to bend or flex the knee, and they're going to extend the thigh. What's that? That's if you're going to go and kick a soccer ball or kick something on the ground. When you go to wind up, pulling your leg back, that's extension of the thigh. So we saw the psoas major muscle and iliacus before when we were talking about the axial muscles. But it's really kind of neat how psoas major and iliacus will kind of fuse together. They'll form together and form a new muscle called iliopsoas. So psoas major we saw in the lumbar spine, and then we saw iliacus, which was lying there on the iliac fossa of the os coxae bone. And so they fuse together, all right, pretty much south of the inguinal ligament. I'll show you that ligament here in a few moments. But what it'll do is it'll attach onto, iliopsoas will attach onto your lesser trochanter. And so that will cause hip flexion. In fact, your iliopsoas is your major hip flexor. Right? It does the big lifting there for that joint there. Okay. So the next muscle is my coffee drinking muscle, the tensor fasciae latae muscle. This is the muscle that will attach onto the iliotibial tract, which is not muscle. Iliotibial tract is connective tissue, and it runs on the lateral portion of your thigh all the way down towards your knee, and it'll fuse with the capsule of the knee there. So the tensor fasciae latae muscle is going to abduct, pull your leg away for the midline, and it'll medial rotate the thigh. Medial rotation is if you have your knee straight, okay, and I say to you, your leg is straight, and I say, okay, do me a favor, turn your toes inwards. So you rotate your hip and turn those toes so they're facing your other foot there. That's medial rotation. The anterior surface of your thigh has turned medially. That's medial rotation of the thigh. All right, a couple of the other muscles that we're going to see now in the medial compartment of the thigh, on the inside of your thigh, are going to be adductor longus, adductor brevis. So you can probably pretty much figure out what those two muscles are going to do. All right, and then we have gracilis and pectineus. All of these muscles, based on their location in the compartment, are going to adduct and flex the thigh. Now, adductor magnus is a very large muscle, but it sits more in the posterior portion of the medial compartment. It sits a little bit more back towards your glute muscles. So it too will adduct, obviously, because its name is adductor, right? But we'll also see it will extend the thigh and also laterally rotate the thigh. So what is lateral rotation? Okay, if your knee is straight, I'll tell you, turn your toes outwards. The anterior surface of your thigh will rotate out and move laterally. That's lateral rotation of the thigh. That's adductor magnus. Then we have obturator externus. This muscle here, you don't need to know it for identification purposes, but you should still know what it does. It is a lateral rotator of the thigh. So here you can see some of our muscles here. And I'm going to draw this line here. That's the inguinal ligament for pretend, let's say. And we'll zoom in. And here is psoas major, psoas minor. You don't need to know it for identification purposes. It sits right on top of it. But here's psoas major. And then here's iliacus. And they kind of come together here and form iliopsoas. We move further down on the medial portion here of the thigh, pectineus, adductor brevis, adductor longus, gracilis. You can see adductor magnus kind of popping through. You can see it better on a medial view here. But all right, these muscles here will adduct or pull the thigh inwards. Okay, a couple of these will flex the thigh. Adductor magnus will extend the thigh, laterally rotate. These other guys here, all right, will medially rotate. All right, posterior portion of the thigh. The biggest muscle that stands out the most is the gluteus maximus muscle. So therefore, it's the biggest, so it's going to do the heavy lifting. It's pretty much going to be doing extension. So when you go to wind up to kick something and you bring your leg as far back as you can, gluteus maximus muscle plays a big role in that. Also, if a patient comes in and they're saying, listen, I've been having problems climbing the stairs, and they're like 22 years old, okay, you're not thinking, well, they're old and they just can't do it. But you're thinking, all right, when you rule out some other conditions, if you whittle it down to, all right, it's a musculoskeletal condition and they're having problems climbing the stairs, we should really take a serious look at the gluteus maximus muscle or the nerves that innervate the gluteus maximus muscle. All right, gluteus maximus also will cause lateral rotation of your hip there. All right, smaller muscles that are deep to gluteus maximus are gluteus medius and gluteus minimus. All right, gluteus medius is very, very similar to the deltoid muscle in your shoulder. It's almost like the deltoid muscle of your lower extremity. Okay, but these muscles are going to abduct, abduct, pull the leg away from the midline, and they'll cause medial rotation. They'll turn your feet in. Your hamstring group, right? They sit on the back portion of your thigh, whereas the gluteus group sits in the gluteal region, kind of on your rear end. Right, but the hamstrings, we have three muscles. The biceps femoris muscle has two heads, a long and a short, but the biceps femoris muscle is laterally placed. And then our semimembranosus and semitendinosus are going to be more medial. Right, when we're talking about their effects on the thigh, they're going to extend the thigh. So they're also going to help you wind up to kick that ball. But they'll also bend the knee or flex the knee. Now, you have a whole bunch of other muscles here listed. Some, the only one that you have to be able to identify is piriformis. But these are smaller muscles that will sit deep to your gluteal muscles. And their job is going to be to laterally rotate the thigh. So you got the piriformis, which we've seen because that's the muscle that's in close proximity to the sciatic nerve. You've got the superior gemellus with its brother inferior gemellus. And then we have obturator internus, and then a square-shaped muscle called quadratus femoris here. So here you can see a lateral view of the thigh. All right, so here's that gluteus maximus muscle, big muscle in the gluteal region. You can see glute medius kind of peeking out here a little bit. That's going to be in the posterior region. Then inferior to that, still in the posterior region of the thigh, we'll have our hamstring muscles back here. All right, this is a lateral view, so we can really see our biceps femoris muscle the best. Right, so we have our long head here and then our short head. Here's that iliotibial tract. Right, and then we haven't talked about the quadriceps muscles yet, but we'll talk about those here in a moment. There's tensor fascia latae. There's my coffee drinking muscle. All right, now we've pulled away a bunch of those gluteus muscles, and you can see, all right, we have a whole bunch of smaller muscles here. We cut away glute medius, cut away glute maximus, glute medius, gluteus minimus, and then we can see all of those smaller lateral hip rotators, right? We've got piriformis right here. Now, unfortunately, we don't have the sciatic nerve to help with that, because if you saw the sciatic nerve, you'd definitely be able to see where piriformis is. And I would let you know. We'll do that when we do our labeling. Okay. Inferior to that is the superior gemellus muscle. And then in between the superior gemellus and inferior gemellus is our obturator internus. All right, so you would think that the two gemelli muscles would be next to each other, but they're not. All right, on to the anterior compartment of the thigh. We've got our quadriceps muscle, quad meaning four. All right, this muscle group has four heads. We've got the rectus femoris, the vastus lateralis, vastus medialis, and then the deep muscle, the vastus intermedius. All right, their job for these muscles primarily is going to be to straighten your leg or the knee extension. That's what they do. All these muscles come together, and they will have the quadriceps tendon coming from the muscles, but then that quadriceps tendon will become the patellar ligament when it attaches onto the tibia, but we have to involve the patella in that to be called a ligament. All right, also in the anterior compartment is sartorius. This is that long strap-like muscle. It is the longest muscle in the body. And so it creates the figure four. So here you are standing. And then I say, hey, all right, can you do a figure four position with your legs? And you do this. That's sartorius, right, is going to flex. So it's going to pull your knee up towards your chest. It's going to turn your knee out, which is going to be lateral rotation, all right, to the thigh. Then when we get down into your leg, right, it causes flexion of the leg because you're bending the knee, but also it's going to cause medial rotation there. Here, let me zoom in a little bit real fast. Here you can see a nice picture of iliopsoas right down here. There's that inguinal ligament that helps to demarcate where those muscles are. All right, so here's sartorius coming right across. It attaches onto the anterior superior iliac spine, crosses anteriorly across the thigh, and then will attach onto the medial portion of your knee. Here's the rectus femoris muscle. You got the vastus medialis on the medial portion of your thigh, vastus lateralis on the lateral portion of the thigh. And then if we dissect or pull away the rectus femoris, you'll see vastus intermedius deep to that. That's where is vastus. There's vastus intermedius right here. It's the deep one. Okay, so that's going to be the muscles that move the thigh and the hip. Now we're going to talk about the muscles that are going to move the knee joints and the leg. So one of the muscles that are going to do that, we haven't talked about it, is gracilis. Right? This muscle here, right, is in the thigh's medial compartment, but it is actually going to cause flexion of the leg, and that's going to be when we bend the knee there. All right. And it's on the medial portion of the thigh, so it will play a role in adduction of the thigh. Right. The hamstring muscles, again, on the thigh's posterior compartment, but they are going to have an effect on the knee joint. We talked about this. You've got your biceps femoris, which is the lateral muscle, and then the semimembranosus and semitendinosus, which are the more medial muscles. So all of these will flex the leg, that's bend the knee, right? But biceps femoris, because it's lateral, is going to laterally rotate the leg when the leg is flexed. Whereas semimembranosus and semitendinosus will medially rotate the leg when the leg is flexed. All right. So keep in mind, this is all based on where they're located. All right. So here you can see that posterior compartment. This is the lateral side. This right here, excuse me, that's not the lateral side. All right. This is the lateral side, and this is the medial side. All right, so here you can see some of these are hamstring muscles here, the semitendinosus and membranosus. Membranosus is more of a flat muscle. Okay, the semitendinosus has a longer tendon, hence tendon being in the name. Okay, membranosus is going to be much flatter. Okay, so now that we're talking about the leg and the muscles of the leg, I want to throw this term out there, the crural muscles. If you might remember when you were going over and learning the different regions and some of the anatomical terms of different parts of the body, you may have seen, all right, down in your calf, all right, there's different names here. Well, the crural muscles, when we describe the crural muscles, we're talking about the muscles that are going to affect the movement of the ankle, the toes, and the foot. So this is basically in the leg, which is pretty much that portion of your lower extremity from your knee down to your ankle. And so again, we're going to divide that area into compartments. And we only have 3 this time. We have an anterior, a lateral, and a posterior compartment. Nothing medially. All right, so in the leg's anterior compartment, okay, we have the extensor digitorum longus, the extensor hallucis longus, fibularis tertius, and the tibialis anterior. Okay, so if you look at the names of these muscles, it'll help you to figure out what they do. Extensor digitorum longus, yes, of course, it's going to extend the toes, right? 2 through 5 digits there, but it's also going to help to dorsiflex the foot. Now, in case you don't remember what dorsiflexion is, that's when you bring the top of your foot up towards your shin. Okay, that is dorsiflexion. All right, extensor hallucis longus, right? What we call the big toe is the hallux, Hallux, the hallux. All right, so extensor hallucis longus is going to extend the big toe, and again, it's going to dorsiflex the foot. Pretty much everything on the anterior compartment is going to undergo dorsiflexion. Fibularis tertius and tibialis anterior, right? They're going to be dorsiflexors. In fact, your tibialis anterior is going to be doing the primary movement for dorsiflexion. That's usually the muscle that's affected first if you get shin splints, because it's doing all that work when you're running or any type of that overuse of physical activity. It does evert the foot, but it does so in a diminished capacity. Now, in case you forgot what eversion of the foot looks like, is if you're standing flat-footed and I tell you to turn the sole of your foot, the bottom of your foot, out away from your body. That's eversion. Tibialis anterior is going to invert the foot. That's going to turn the sole of the bottom of your foot in, all right, towards your other leg. So we saw in the upper extremity, we had a retinaculum down by the wrist, and its purpose was to help hold all those tendons from the forearm against the bone so they're not popping off, right? We see something similar here in our ankle. We have the extensor retinaculum, right? It's that dense connective tissue, and its job is to hold those tendons close to the ankle, so they're not popping off. If that were the case, you'd see a webbing there. So if you look down here at the bottom, here by our ankle, you can see here's the extensor retinaculum. Look at it all over the place. And all of these tendons that are underneath it. So it's holding tight to keep those tendons close to the bone. Otherwise, it would just be popping off the bone. It would still be attached onto the distal portion, but you know what I mean? It would look like a contraction of that platysmal muscle, like in your neck that you saw of that guy with the webbing of his neck. That's what you would see. All right. So this is a very important tissue to have. It helps a lot with the proper functionality of the muscles. So here you can see some of those muscles I was going over. Here's tibialis anterior, your primary dorsiflexion muscle. You can see how it attaches onto the medial side of your foot here. So when it contracts, your foot is going to turn inwards. Okay, so here are each of the individual tibialis anterior, flexor digitorum longus. Now you can see the tendons go all the way to the distal portions there of your lower extremity, and then extensor hallucis longus is one tendon that's going to go down here towards, all right, the distal portion of your great toe. All right, let's talk about the lateral compartment. It's really easy because there's only two muscles there. All right, their job, because they're on the lateral side of your leg, is to turn the bottom of your foot outwards. That is eversion. So they help to evert the foot. They will help, all right, with some plantar flexion. In case you forgot what plantar flexion is, if you're standing there in the anatomical position and I say, okay, all right, try to stand up on your toes, okay, when you go to do that, all right, and point your toes down towards the floor. That's plantar flexion. All right. What I tell folks, the easiest way to tell the difference between fibularis longus and brevis, aside from the names, all right, you know that one's going to be longer than the other. Fibularis longus, the muscle belly is going to be closer to the knee. Fibularis brevis, its muscle belly is going to be closer to the ankle. So you can see both of them here. We do the labeling, it'll be a lot easier. All right, so here's fibularis longus. See, the muscle belly is closer to the knee. And then we come down here, all right, to fibularis brevis on either side of the tendon here. See, it's closer to the ankle. You can see it really nicely here individually. All right, so again, primarily their job is to evert the foot, only two of them, right, and they will help with a little bit of plantar flexion. All right, the posterior compartment muscles. We got a bunch of muscles here. And so therefore we divide them up into layers. We have a superficial layer and a deep layer. The superficial layer is made up of two big muscles. One is called the gastrocnemius. That is the most superficial muscle. So if you see somebody running around and you're looking at their calves and you're like, ooh, that person's got nice calves. Well, that's the gastrocnemius muscle. Okay, it has two bellies, lateral and medial belly that attaches onto the femur. Okay, so it has two movements. It will help to flex the leg. Okay, so that's bending of your knee. And it helps to plantar flex the foot. What is that? If you're going to jump as high as you can, say you're playing basketball and you want to do a layup or you want to slam dunk the ball, your gastrocnemius muscle is the heavy lifter in that case. It's going to cause that plantar flexion if you're trying to jump off of your toes. Right? It is more of an explosive type of muscle. It has a lot more those glycolytic muscle fibers for explosion. Soleus, which is just deep to gastrocnemius, it also plantar flexes the foot, but you use it more when you're walking around. Okay, not to say that you won't use it at all if you're trying to explode into a jump. Okay, but soleus, all right, does more so when you're just like going through a regular, normal, leisurely gait. Well, when we are talking about both of these muscles, we call them the triceps surae. So gastrocnemius and soleus are going to come together and they're going to attach onto, all right, your calcaneus or your heel with the help of the calcaneal tendon, also known as the Achilles tendon. All right, we refer to that as the triceps surae. All right, our deeper layer, right, we have the flexor digitorum longus, the flexor hallucis longus, tibialis posterior, and popliteus. Flexor digitorum longus, again, this muscle tells you what it's doing. Right? The longer muscle is going to be found in the leg. The shorter muscle will be found in the actual foot, the muscle belly itself. So the flexor digitorum longus attaches to the distal phalanx of digits 2 through 5. And so it is going to flex all the joints proximal to that. That means the distal interphalangeal joint, the proximal interphalangeal joint, the metatarsal phalangeal joint, and it will also help to flex the foot. So it flexes all those joints. So if you ever dropped something, when I was younger, I was actually really good at picking things up with my toes. I could drop a pen or a pencil and I would stand there and pick it up with my toes. So when you're doing that, you are utilizing the flexor digitorum longus. Flexor hallucis longus, again, there's that hallucis. We know we're talking about the great toe, right? So this muscle is going to flex your big toe, and it'll also flex the foot there. Tibialis posterior, this is going to invert the foot because it's more medial, and it is going to help with plantar flexion. And then popliteus is close to the knee joint. So it is going to offer some flexion of the leg, right? But when you kind of are standing there, this muscle will help to lock your knee into place. And we call that medially rotating the tibia there. So when you look at the picture here, you can see beautiful image of our superficial layer here, the gastrocnemius muscle. It's got its two muscle bellies there. Just then you can see just lateral to that is the soleus. And then the gastrocnemius and the soleus are going to attach onto the calcaneal tendon, or the calcaneal tendon is going to distally attach both of those muscles onto the calcaneus here, onto your heel. And then if we dissect those muscles away, we'll see some of our deeper muscles here. Okay, so we have our tibialis posterior. All right, and then you can see, all right, we've got fibularis, not fibularis long, where am I? Flexor digitorum longus, just medial to that, and then flexor hallucis longus on the lateral portion there. But if you notice, now take a look, the muscle bellies are scattered about. Okay, flexor hallucis longus, its muscle belly is more towards the lateral portion, but it's all where the tendons go. Look, the tendons are all going to the medial side. And they all go medially. Here you can see all those muscles nice and individual-like. All right, last part here, and then we'll do some labeling here in a few moments. Okay, let's talk about the intrinsic muscles of the foot here. All right, so these muscles are going to primarily offer us arch support and move the toes. Right? Arch support and move the toes. Also, the ligaments will help with arch support too. So that's why, there is physical therapy, there is rehab for folks that have fallen arches, but there's only so much that you can do in strengthening that because the ligaments also contribute to arch support. Okay, so the dorsal group, what is that? That's the group that's on the top of your foot. So we've got the extensor hallucis brevis, right? So obviously it's going to extend your great toe, and it also offers extension at the metatarsal phalangeal joint. Okay, extensor digitorum brevis. Now notice there's a difference here. It only attaches onto digits 2 through 4. And so it's going to extend your proximal interphalangeal joint and your metatarsal phalangeal joint. The plantar group, on the underside of the bottom of your foot, right, we have 4 layers. I'm just going to show you some of these. You're not responsible for knowing these for lab, okay? But you should, this is an anatomy course. I still need to show you this, okay? So the plantar group, okay, they're all going to be held into place, right, through the aponeurosis or the deep fascia. You may have heard of plantar fasciitis. That's when that connective tissue gets irritated and inflamed. And so the deep fascia can take months. In some cases, I've seen some patients where it's taken about 6 months or so, and it's not fun. All right, but we'll go through the muscle groups here real quick. All right, if you're number 1, okay, if you're number 1, you are superficial. And if you are number 4, you're deep. Okay, so if we're looking here at layer 1, that's our most superficial. So we got flexor digitorum brevis, abductor hallucis, abductor digiti minimi, right? So this guy here, right? Remember what we talked about, how one of them, when we were talking about flexor digitorum longus, we didn't see how it attached onto the 5th digit, okay? Because we have our intrinsic muscles that are going to do that for us. All right, 1 second. I'm trying to fix something. All right, good. Okay, so into the second layer here, the deeper layer, now you'll see we've got, again, I'm not going to go through all these. We have our lumbrical muscles and we have our quadratus plantae here. And then when we go into the even deeper layer, you can see all, now we're starting to get a little bit crazy with some of the muscle configurations here. Look at adductor hallucis. This is something that always impressed me. How adductor hallucis pretty much goes transversely across. But this is one of those muscles here, right, with adductor hallucis that helps to support one of the 3 arches of your foot. Okay, you have the 2 major arches. You have the lateral arch, you have the medial arch, and then you have what's known as the transverse arch. Well, the transverse arch is the one that usually is damaged or falls first. And then you can see here in our last layer, we have our interossei muscles. Okay, plantar and dorsal and interossei. Okay, let's climb into some labeling for our atlas, and then we'll call it a night. All right. So I'm just going to quickly show you psoas major, because you know where I'm probably going with this. We're going to eventually talk about iliopsoas, but here's our psoas major in our abdominal cavity, moving down into the pelvic cavity. It attaches into the lumbar spine proximally, and then distally it's going to head down towards the femur. I'm going to show it to you on a different model. Here you can see it in a much better view in the lumbar spine there. That is our psoas major muscle. All right, that leads us to the iliacus muscle. It sits in the pelvic cavity, right on the anterior portion of your os coxa and the iliac fossa there. And so iliacus, I'll show you on another model here. There it is. Okay, so iliacus and psoas major are going to join together collectively to help create iliopsoas muscle, the strongest hip flexor of the thigh. Yay. Okay, so that attaches on to the lesser trochanter there. So if you notice, there is something that's not a muscle. Well, a couple things. This right here. These structures that I'm showing you, because I'm going somewhere with this, right? You have a blue structure, a red structure, and a yellow structure. Okay. If it's blue, most likely it's a vein. If it's red, most likely it's an artery. And if it's yellow, most likely it's a nerve. I'll let you know otherwise. But they're all together here, and we call these collectively the femoral van. V-A-N. You can probably figure out what that means when I'm referring to it as the femoral van. V for vein, A for artery, and N for neuron. Okay, femoral van. That's an anatomical structure. You don't need to know that per se, all right, but I use it as a landmark, okay, because you're going to talk about some of the muscles here in the anterior thigh, which we're going to visit here in a second, but the iliopsoas muscle is usually lateral to the femoral van. And then the medial compartment muscles over here are going to be medial to the van. More on that in a little bit. All right, let's go to the posterior portion of your thigh. Get into the gluteal region. Let's talk about the gluteus maximus muscle. I'll outline it here for you. There you go. That's the gluteus maximus muscle. It's the largest, most powerful hip extensor. It brings your leg back. I'm going to show it to you on two other models. Here it is on a posterior view. You can see it's the predominant muscle in the gluteal region there. And then right here, I'll show you on this model. Okay, that's gluteus maximus. Deep to that is the gluteus medius muscle. Gluteus medius is also more superior. So here is the gluteus medius muscle. Here it is on this model. Keep in mind, gluteus medius is deep to our gluteus maximus muscle. All right, and here you can see it on this model. All right, gluteus medius, the deltoid of the lower extremity. It helps to laterally rotate, abduct the thigh. Right below or inferior to gluteus medius is the piriformis muscle. Now this model is nice because it shows you the sciatic nerve. This is yellow in case you can't tell, right? Nerve. The sciatic nerve, okay, is inferior or right below the piriformis muscle. The piriformis muscle in a small percentage of people, all right, I can't remember if it's 1 or 3%, but the sciatic nerve can pierce right through the belly of piriformis. So if anyone has issues, there's a condition called piriformis syndrome when that muscle goes into spasm, or if it becomes hypertrophy for whatever reason, it can press on the sciatic nerve and cause sciatica-like symptoms. People often confuse it for sciatica, but it could be a case of piriformis syndrome. Here you can see the piriformis muscle, again, superior to the sciatic nerve as it exits out, all right, and go into the posterior portion of the thigh there. Okay, lateral view here. This is not a muscle. I repeat, this is not a muscle. This is the iliotibial tract. Okay, it is a thin sheet of connective tissue that sits in the lateral portion of your thigh. The lateral portion of your thigh, and it will connect to the capsule of your knee. Okay, one of the muscles that I'm going to talk to you about attaches onto it. There it is. There's the coffee drinking muscle, the tensor fasciae latae muscle. It attaches right onto the iliotibial tract. Okay, going over onto the anterior view of our lower extremity. There's the van, the blue, red, and yellow structure. We're medial to the van. If you're not sure, go over here and look at the, I don't know how to say that, the far out view, the entire view of the lower extremity. Go down to the foot, look for the big toe. The big toe is medial, the small toe is lateral. So I know I'm on the medial portion of my lower extremity, right? We're in the adduct or in the medial compartment. So the first muscle here is pectineus. This is one of the adductors of your thigh. Just inferior to that is another adductor of the thigh, and that's adductor longus. You can see it in two views here. We can see it here on the anterior view, and now we're going to look at it from the medial view. There's adductor longus. All right. Way in the back here, because this is anterior and this is posterior. So in the posterior portion of the medial compartment, you can see adductor magnus. Now I skipped this muscle here. I'll show you that in a second. Okay, that's adductor magnus. And then there's gracilis. Okay, so gracilis sits in between your adductor magnus muscle and the adductor longus. All right, here's the longest muscle in the body, sartorius. It's that long strap-like muscle, allows you to do the figure 4. So you can see it here on the anterior view, but you can see it better, in my opinion, on the medial view. This is sartorius. Again, it's going to originate or attach onto the anterior superior iliac spine. That's where your iliac crest, the top of your hip bone, comes all the way to the front anterior portion of your pelvis. And then sartorius is going to go and attach onto the medial inside of your knee. That's sartorius for you. All right, let's get into the muscles of the anterior portion of the thigh. Remember that muscle group, the four muscles, the quadriceps muscle. The most anterior muscle of the quadriceps, it sits front and center right in the middle of your thigh, is the rectus femoris muscle. So you can see it nicely here on the medial view, but you'll see it really nicely here on the anterior view. There's rectus femoris, and then we can see it again on the lateral view. So everything to the left of that red line that I just drew is rectus femoris. Rectus femoris. Okay, so going to the medial view again, we can see vastus medialis. This is really nice depiction of vastus medialis on the medial view here. And here you can see it on the anterior view. We pulled out rectus femoris out of this dissection. All right, now we'll bring it back. So there's vastus medialis with rectus femoris. Here's vastus medialis without rectus femoris. Just thought I'd show you both. Here you can see vastus lateralis. This muscle is going to be in the lateral portion of the anterior region of your thigh. And here it is without rectus femoris. Here it is with rectus femoris. You can see it really nicely from the lateral view here. And so it's going to be in between this red line that I just drew and the iliotibial tract. That's vastus lateralis. Those muscles help to straighten your knee, or your leg, I should say, or extend the knee. And then the last muscle, it's deep to the rectus femoris, is the vastus intermedius muscle. So all four of those muscles, okay, will attach onto the quadriceps tendon. All right, onto the posterior part of the thigh. We're going to look at the hamstring muscles. So we'll look at the most lateral one. That's the biceps femoris muscle. Biceps femoris. Then we go more medial. Oh, excuse me. Here it is from the lateral view. And then we'll move more medial. So if you notice, the arrow here is pointing to the semitendinosus muscle. And so I'm going to kind of highlight part of that. All right, so in between those two red lines is the semitendinosus muscle. Okay, the semitendinosus muscle has a longer, more prevalent tendon than semimembranosus. I don't know if you recall this earlier. I was saying that semimembranosus is a more flat muscle. So you can see now, right, we have two arrows pointing to semimembranosus. So you can see the distal portion of semitendinosus is covering semimembranosus distally. See, there's semitendinosus, and then either side of those red lines, semimembranosus. Okay, let's get down into the crural muscles here. Right, posterior portion of our leg. There's the gastrocnemius muscle. You can see it from all those different views there. That's the gastrocnemius. There's the calcaneal tendon to which the gastrocnemius muscle is attached to, also known as the Achilles tendon. And then deep to gastrocnemius is soleus. That's our triceps surae, when we have gastrocnemius and soleus together, attaching onto the calcaneal tendon. All right, there's the soleus muscle. Here you can see a nice lateral view of the soleus muscle. All right, let's look at the lateral compartment. If you recall, there's only two muscles in the lateral compartment. They are the everters of your foot. So you have our fibularis longus, also known as the peroneus longus. I failed to mention that in the lecture portion of the lab presentation here. Okay, but you can either call it fibularis longus or peroneus longus. Again, the longus muscle is closer towards the knee. It's tough to kind of see here. Hopefully I won't mess it up, but here's the muscle belly, then it comes down here to the tendon. Right, so that's fibularis longus muscle. And then brevis is going to be closer to the ankle. So here you can see it down there. So here's the other part of brevis right here. Peroneus brevis or fibularis brevis. That's a great question, Kelsey. A very good question. No, you don't have to say of the hamstrings or of the quadriceps. You can just say rectus femoris or biceps femoris. You don't have to put what muscle group. No one really says that. I know, just to cover your bases. You got it. All right, so here onto the anterior compartment. We've got our shin muscles. We have tibialis anterior or anterior tibialis. That is the most medial muscle on the anterior compartment of your leg. Flipping over to the posterior, deeper muscles. Okay, here's the tibialis posterior muscle or posterior tibialis. You can see flexor digitorum longus on this medial view here. That is deep to soleus. Then we have extensor digitorum longus here. It's going to be more lateral to tibialis anterior. And then the last one you need to know is the patellar ligament, also known as the quadriceps tendon. That's all, folks. You now have all of the